Welcome to the podcast. I'm Tiebin Liu, a statistician working in rare disorders and health outcome team in the birth defects monitoring and research branch at CDC. I'd like to present our study recently published in Developmental Medicine and Child Neurology, Education and Employment as Young Adults Living with Spina Bifida Transition to Adulthood in the USA, a study of the National Spina Bifida Patient Registry. Spina bifida is a neurotube defect and complex chronic condition that affects multiple organ systems. Spina bifida can add further challenges for youth as they navigate increasing roles, responsibilities, and interdependence as they age into young adulthood. Previous studies have shown that young adults with spina bifida experience multiple challenges in achieving educational and employment milestones when transitioning to early adulthood. In this study, we aim to describe the education and employment transition experience of young adults with spina bifida and investigate factors associated with employment. The factors we explored include socio-demographic, spina bifida-related factors such as type of spina bifida and level of lesion, as well as specific health outcomes such as bladder and bowel continence. We hypothesized that young adults with spina bifida with more severe condition-related factors and less optimal health outcomes would have lower levels of educational attainment and rates of employment. For our analysis, we extracted data from the National Spina Bifida Patient Registry for participants ages 18 to 26 years at time of their visit between 2009 and 2019. For our descriptive analysis, the outcome variables are educational attainment and employment status. To account for repeated observations of employment status and other time-dependent variables from the same person, we used generalized estimating equations, or GEE models, with logit link function. The outcome of the main analysis was any employment. An outcome of sub-analysis was full-time employment among all visits at which participants reported being employed. From these figures, we can see orange and green bars demonstrate higher levels of education and employment, and those generally increase with participants' age during the transitional period. Participants with non-myelomeningocele showed higher education attainment and increased rate of employment than those with myelomeningocele. In the main analysis, multiple GEE regression models showed that any employment was independently and significantly associated with higher education level, sacral lower extremity functional level, being continent of bowel, a history of non-shunt surgery since last visit, and having private health insurance. In the subsample analysis, full-time employment was independently and significantly associated with older age, higher education level, non-myelomeningocele spina bifida type, being a community ambulator, and without skin breakdown since last visit. In conclusion, we found low rates of educational attainment and employment in young adults with spina bifida with a large national sample as they transitioned from adolescence to young adulthood in comparison with the US general population in the same age range. Specific socio-demographic, medical, and functional factors were associated with a higher likelihood of attaining employment in early adult life. Some employment-associated factors, such as continence and self-management skills, are modifiable. By considering the educational and employment goals of their patients with spina bifida, clinicians could focus their care interventions on factors that facilitate the transition process. Additional research could help us understand how cognitive functioning and social determinants of health, such as health insurance, access to health services, family supports, and health status influence young adults with spina bifida in employment, quality of life, and transition into adulthood. I'd like to take this opportunity to express my sincere appreciation to my co-authors for this great collaboration, and thank you for watching.